Thank you so much. It's so good to be here. I've been to this meeting a couple of times before, most of the time in the audience, with all of my former colleagues at ACS and other familiar faces. When I got here today, I got to see a lot of old friends and colleagues, and I think the question I get asked most often is, so how are you doing? How's it going? And I try to exude the aura of control. Everything's fine. That's very comforting to all of you, I'm sure. Because it's not quite a sprint, it's not quite a marathon, but it's like sprinting a marathon. And that's what we are doing. But October 1st is right around the corner, and I'm sure it will get enormously easier on October 1st, right? October 1st is not the end, it's the beginning. That's what I keep telling everyone. And so today I'd like to tell you a little bit about what's going to happen on October 1st here in New York. I'm going to give you a little bit of a sneak peek into our state's health plan marketplace, a little bit about what consumers can expect. So I am pleased to tell you that New York State of Health will open on October 1st. This is our state's official health plan marketplace. As you may know, New York is one of 19 states that are running their own health plan marketplace. The remainder of the states will have a federally run marketplace in their state. And so there's a lot of advantages to New York running its own marketplace. I think you'll see throughout this presentation that there's a lot of features and benefits of our marketplace that are unique and distinct to New York that will benefit New Yorkers. There's health plans that they may be familiar with. There's going to be a lot of resources that are community-based that will really connect New Yorkers to the coverage that they need. I should know what's coming next, but I actually don't. There we go. So here's it's just sort of a very high level, like a 30,000-foot view of what New York State of Health is. So this is an organized marketplace. This is a store where people will come to buy health coverage. It's one-stop shopping for health insurance, which really is revolutionary in New York. We really don't have such a thing right now. People will be able to access both subsidized and unsubsidized coverage in the new marketplace. There will be ways to easily compare your health plan options. It'll be the only place to get financial assistance, those subsidies, to help offset the cost of coverage, and I'll describe those for you a little bit. And the marketplace will enroll people on the spot, so you can shop, compare your options, and enroll all in one place. There are two programs within the marketplace. When you walk in this singular front door, there's two directions you can go. There's a program for individuals and their families that will be buying coverage directly from an insurance carrier. These are folks that don't have employer-sponsored coverage or, for whatever reason are transitioning a source of coverage and need to get insurance directly through a carrier. And then there is a small business marketplace where employers with 50 or fewer employees will make coverage available to their employees to purchase through the marketplace. So let me tell you a little bit about our enrollment projections. So at full implementation, the marketplace expects to enroll about 1.1 million New Yorkers into coverage. And that will take approximately 2.5 to 3 years, we think. And about a little more than half, about 615,000, will come in as individuals and their families buying directly from a carrier, and about 450,000 will come in through the small business marketplace. I want to tell you a little bit more about what we know about our enrollment population. There are slides on our website that get very detailed around the demographics of who we think will enroll, and I could do an entire presentation just on this, but I'm going to give you a couple of highlights that I think will be important to you. So first of all, this is primarily for people under the age of 65. This is not a marketplace for people that have Medicare or are eligible for Medicare. Medicare is considered comprehensive coverage. People should not be, denying Medicare to come to the marketplace. There's no reason to do that. So the first thing is that this is primarily for under age 65. The marketplace and Medicare, for the most part, really do not intersect. The second thing is that we expect that we'll see a majority of people coming into the individual marketplace who are uninsured. However, there will be people coming to the individual marketplace that have coverage now, and that's for a variety of reasons. Some of that coverage may be going away. So, for example, Family Health Plus and Healthy New York for individuals, both of those programs are going away, and all of those subscribers will come to the marketplace to get coverage. You may have folks that have employer-sponsored coverage that's deemed unaffordable according to the federal definition, which is greater than 9.5% of their income. If they're paying more than that, that coverage is deemed unaffordable, and they're welcome to come to the marketplace to buy coverage. We're trying to cast as wide a net as possible for people to come to the marketplace and see what they're eligible for. But in most cases, people with employer-sponsored coverage probably would not come to the marketplace to transition that coverage. This will be mostly for people that are uninsured or people whose coverage is going away. People who lose their jobs, lose employer-sponsored coverage, can come to the marketplace and get covered. We also see a market here for the dependents and the family members of people who have employer-sponsored coverage, but whereas those family members may not be covered or may not be able to get coverage at an affordable rate. So those are the types of individuals we see in this individual market. And then again, in that small business marketplace, this is a marketplace for employers with 50 or fewer employees. In 2016, that small business marketplace will grow to apply to employers with 100 or fewer, but for the first 2 years, it will be employers with 50 or fewer. They come in, they select options that their employees can choose from, and those employees will come into the marketplace and choose their coverage options. I want to tell you a little bit about open enrollment and how enrollment will work. So open enrollment begins on October 1st. And individuals can enroll in a health plan during an open enrollment period. This is a little different than how the current individual market works right now in New York State. Right now, if somebody wants to buy a plan directly from a carrier, we have continuous open enrollment, and they can do so any time of year. So that will change with the new marketplace. There will be open enrollment for individuals. Year one, open enrollment is 6 months long. It goes through the end of March. Keep in mind that any coverage that someone buys in the marketplace is not effective until January 1st of 2014 or later, depending on when they enroll. If an individual misses the open enrollment window, they can come into the marketplace with a qualifying event. This is very similar to how it works in the employer-sponsored market right now. You have a marriage or a divorce or the birth of a child or a change of status or maybe loss of employer-sponsored coverage. Those are all qualifying events that will entitle you to your own open enrollment within the marketplace. However, showing up in the ER with a broken leg is not a qualifying event. So people cannot come into the marketplace without an officially federally defined qualifying event. So we want to make sure that we make the most as we can of these open enrollment periods and that we're promoting this as widely as we can throughout the state. So this is the open enrollment period for the calendar year 2014. And then in the fall of 2014, there'll be a 7-week open enrollment period for the calendar year 2015, and so on. That pattern will then continue. So year one, we get a full 6 months, but after that, we get about a 7-week window every fall for open enrollment, which again is similar to what you might find in your workplace. The individual market will mirror that in some ways. There are some exceptions to what I just said. So the marketplace, by the way, I haven't actually gotten to this slide yet. The marketplace is also an entry point for New York State Medicaid and Child Health Plus. When I said one-stop shopping, I truly meant it. People who are eligible for Medicaid can come to the marketplace. If people are not sure, they'll come to the marketplace. They'll get their eligibility determined for them. They may find out they're eligible for Medicaid. The marketplace will enroll them directly into Medicaid. So think about that, online Medicaid enrollment in New York State. It's really remarkable. So if someone is deemed eligible for Medicaid or their kid's eligible for CHIP, they can be enrolled into those public insurance programs any month of the year. So if in July a family presents, it's determined that they're eligible for public insurance, they can enroll in those programs. So continuous open enrollment for public insurance still stands. That won't change with the marketplace. The marketplace will just help facilitate that enrollment. And then finally, small employers can come into the marketplace at any time of year. Usually they'll come in when their current policy is up for renewal. They get to choose their own open enrollment dates for their employees, and they, again, can work on their own individual calendar for when they want to offer coverage to their employees. So clear as clear as mud, right? So open enrollment is, a little bit of a complicated scenario, but we want to make sure that people understand that it's different for individuals and small businesses. So the heart and soul of the New York State Marketplace will be the enrollment portal that is in rigorous final stages of testing right now and will be available on October 1st. This is how a vast majority, almost all of the enrollment will be processed in the Marketplace. A brand new enrollment web portal. This has been in development for 2.5 years. This is one of the projects that New York was an early innovator state that we were funded to do the IT development. So again, we'll have one web portal that will process applications for Medicaid and Child Health Plus, for individuals enrolling in coverage directly from a carrier, and also our small business marketplace. To support the online enrollment for New York State of Health, behind that is a first-class customer service center that will help people by phone answer their questions, and they can enroll people in coverage too, right through our customer service center. The customer service center is run by Maximus. Many of you may be familiar with them because they run some customer service work for the Medicaid program. They're expanding to become the statewide telephone customer service center for the Marketplace. They went live on Monday of this week to answer questions and provide guidance to people who call. They're not yet taking applications, and they will begin to do so on October 1st. I can tell you that as of the end of the day yesterday, end of day 3, they have already taken over 2,000 calls from New Yorkers asking questions about what their coverage options are. So we're really pleased with how the call center is functioning so far. Another key feature of the state marketplace lies in the in-person assistance that consumers, small businesses, and individuals can get to help understand their options and enroll in coverage. So I talked about enrolling online, which anyone can do anytime from the privacy of their home. They can call customer service and get help that way. And the third way to enroll is through one of our navigators or one of the other in-person assisters that will be available across the state. So let me tell you what these look like. So the federal law requires every state to have a set of navigators across the state that will help enroll people in coverage. So this is the facility. I'm sure you're all familiar with the state's facilitated enrollment program. That program has essentially merged into our new Navigator program. So facilitated enrollment has gone away in a sense and been replaced by the Navigator program. Navigators are organizations and individuals that will meet one-on-one with consumers to help them understand what they're eligible for and process their enrollment, facilitate their application into coverage. There are the navigators were awarded grants back in July from the New York State Department of Health to be navigators for the new marketplace. They are in training as we speak. They are training throughout the month of September, and they will be ready to provide services on October 1st. I'm going to tell you a little bit more about navigators in the next slide, but let me also talk about the other types of assisters. The marketplace recognizes that the small group market, the small employer market, is primarily connected to coverage right now through the services of licensed insurance brokers. And we think that's an important distribution channel in the state. And so we've defined out how insurance brokers can have a role in the marketplace by connecting small employers to coverage. So there is a training and certification program that a licensed insurance broker can take in order to sell products in the marketplace. They will continue to be paid the way they are now, which is through commissions from insurance plans that are negotiated between plans and brokers. They, again, will complete a training and certification course. They can choose to sell products in the small group marketplace, the individual marketplace, or both. The training and certification for each are the same. They're not the same. They're different, but they are separate. There's a training and certification for small group, training and certification for individual. We know that about 2,500 brokers have already taken the small group training and certification course in New York. So we expect there to be a very significant number of boots on the ground to help people enroll in the small group market in particular. And finally, there is a federally designated category of assisters called certified application counselors. These are organizations that see enrolling people in coverage as central to their mission, yet they don't fall in one of these first two buckets. So the state is going to be providing a training and certification program for the others, if you will. These are hospitals, federally qualified health centers, other types of healthcare providers. Health plans that currently enroll people in coverage will be getting trained and certified to use our enrollment portal and facilitate enrollment for people. The Certified Application Counselor training is starting up very soon. We're working through the navigators now. CACs come next, and we expect to have those trainings completed through the course of the fall so that on January 1, when coverage is effective, we will have a lot of boots on the ground helping people enroll in coverage. So just a couple more words about the navigators across the state. We have funded, just for year one, $27 million to the organizations that will become navigators. There are 50 organizations that received awards to be lead agencies, and they subcontract with about 96 subcontractors. So that's a total of 146 funded organizations across the state with about 430 full-time staff that are doing enrollment support across the state. You can see on our website today a list of every funded agency by county. There's a link. That link right there takes you to this document, which is a spreadsheet of all the funded organizations. This will morph into a schedule of where in every county you can find a navigator, what days, what times, what languages will be spoken at that site, and any other details that a consumer might need. So this will be a really important resource for all of you when you encounter consumers who have questions or don't quite know how to find the marketplace. You can connect them directly to a navigator through the directory that will be available on our website. If someone calls our call center or goes on our website, they will also be able to find a navigator. They can search by where they live or by what language they speak, and they can find information about where the closest navigator is. So I want to say a little bit about the types of insurance plans that will be available in the marketplace, what consumers can expect when they come. Now we know sort of who the marketplace is for and how they can come through the front door, but what will they find when they get there? So this is a snapshot of our plan participation. This slide shows you the companies that have been certified to provide plans for sale in the marketplace. This is a combination of those that will sell in the individual market, the small group market, or maybe both. You can see a lot of familiar names up here. There's going to be a lot of consistency in what's available across the state. There's also a couple of new players, and there may be some companies that offered only in one part of the state that have decided to expand into other parts of the state. And we also have some brand new licensed carriers in the state of New York providing coverage. So this is good news for consumers. There's choice, there's competition, that keeps prices low for everybody. So this is good news. The next slide shows you who some of the dental carriers are. And the reason I show you this is because not every medical plan may include dental, but we wanted to make available dental coverage for adults if their medical plan didn't cover it and they wanted to access that coverage. This is not adult dental is not required under the federal law, but New York is making it available to people who want to purchase a separate standalone dental plan. So here's a couple of highlights of our health plan participation. There will be choice of plans in all areas of the state. That's not necessarily true now in some rural counties. There may not be more than one carrier offering services, so this will greatly expand choice for consumers. Consumers will have new options to choose from. Premiums for people who buy directly in that individual market that we talked about are on average 53% lower than they are today. That individual market it's unstable, it's unaffordable for many people, and premiums will drop remarkably for people that are buying in the individual market. This is good news for consumers. And as per federal law, no one will be denied health insurance on the basis of a pre-existing condition, and all plans will be required to have adequate networks, and the state will be looking at network composition over the course of time to make sure that there are an adequate number of providers behind all of these plans so that consumers have access to their doctors. I'll also say, because I think this is important, especially for this audience, that consumers can search for a health plan based on a provider network. If there's certain doctors that they absolutely want to have in-network in their plan, they can filter by that information. The entire plan network will be transparent to consumers when they're looking at their plan options. So again, just another feature of the enrollment web portal. As you may know, the federal law requires coverage of 10 essential health benefits. These are the categories of benefits that are going to be covered in every plan available inside the marketplace. These are also required benefits for every plan sold outside of the marketplace in New York as well. So sort of a new floor for the coverage of benefits. And the next slide just pulls out for you. I wanted to highlight what the cancer benefits are for plans in New York State. As you know, all the preventative services are covered. You should look a little bit closer at the federal law to understand a little bit more about the cost sharing for these. But most preventative services defined under the federal law have no cost sharing for consumers. Immunizations, tobacco cessation is covered, chemotherapy, radiation, reconstructive surgery, second opinion, off-label use for cancer diagnosis, for prescription drugs. These are all covered benefits in the essential health benefit package in every plan offered in the marketplace. I'll just say a little bit about financial assistance available in the marketplace. In fact, I'm going to go to the next slide and just demonstrate it for you. Financial assistance is also one of the key features of the marketplace to help make coverage more affordable. And it's made available through two forms. The first is a tax credit that's applied directly at the time of purchase to reduce the cost of a premium. And it's also for lower income people, 250% of federal poverty and below, they'll also get a reduction in cost sharing. So deductibles and co-payments will be lower for those folks. This slide just illustrates what those the advanced premium tax credits look like. So here in Albany County, I'll just give you one illustration. An adult earning $20,000 a year, all of their information input into the portal tells us that about $209 a month is available to them to offset the cost of a premium for any plan they want to buy. If they bought a silver level plan, which is a plan that has about a 70% actuarial value, they can buy a plan for starting at $85 a month. For all of those benefits we just saw in that previous slide, the lowest cost plan in Albany County is $85 a month. That's not where they end. Consumers can certainly choose a higher cost plan that may have the network they want or may have the type of quality rating that they want. Consumers will have choices, but to give you a sense of where they begin, these are what premiums might look like in the individual market for someone at this income level. This illustrates for you what it looks like for a family of four at $50,000, 2 kids, 2 adults. The kids are automatically eligible for Child Health Plus, and the parents can get a plan starting in Albany County at $280 a month for those parents to get covered. And so that household is looking at starting at $300 a month for comprehensive coverage for everyone in their family. And so I'm just going to jump ahead to, I think I only have 2 slides left. Next slide. This is where I want to end. So I want to just give you a sense of statewide media and public awareness around the marketplace. So you see our new name and our logo. It was unveiled on August 20th. We are in final production for a creative campaign that will run on television, print, radio, digital, and out of home, which is the new term for things like billboards and transit ads and things like that. You'll see a pretty comprehensive multimedia campaign launch on October 1st. There's some public relations work to back that up through some earned media work that a PR firm that we have contracted with is doing for us. And then finally, we are already active on social media channels, and we'll be pushing a lot of content out through social media beginning on October 1st. And then this just concludes for you what our consumer-facing message is for our new marketplace. This is a new gateway for coverage. This is a place where comparing and finding coverage has never been easier. We've taken away the hassle. We've given you help. We're giving you assistance. And we really think that this will set people up for the protection that they need for all types of life events. So that is our new marketplace. This last slide is just a snapshot of our website and then our web address and our phone numbers on that last slide. Actually, I have to put the phone number on there, don't I? And on your table is just a one-page leave behind that I wanted all of you to have that crystallizes some of the points I talked about today. And you can take that with you and check out our website for more of these types of materials. Thank you.